decided to say no. So then they're going to some other or non-care, you know. So I thought that was enough of a framework. I'm going to just briefly go over a 3-page document that is from the American Academy of Pediatrics. It's called Responding to Parental Refusals of Immunization of Children. And then I thought we could have some discussion, unless you have maybe another piece to add before I
Sure.
Good. So again, like Eliza had said, immunizations of children against infectious agents is hailed as one of the most important health interventions of the 20th century. By some accounts, pediatric immunizations essentially prevent at least 3 million deaths in children per year in the world. It's ironic that because of the remarkable success of vaccines, most parents have no memory of actual polio or measles or other vaccine-preventable diseases. So it's hard for them to appreciate the benefits of immunization. Do you guys know what the most frequently refused vaccination is in the U.S.? No? Close? That's number 2. Chickenpox is number 2.
Is it MMR?
MMR is number 1. Do you have any historical context for why that might be?
Dr. Wakefield.
Exactly. Former Dr. Wakefield. Anyway, I thought this was interesting. A small number of pediatricians reported that they always, 5%, or sometimes over 18%, tell parents that they'll no longer serve as the child's physician if the parents continue to refuse permission for immunization. So to me, that's almost 25% of pediatricians are doing that. Obviously, the AAP strongly endorses immunizations. So in this report, they wanted to think about 3 distinct issues. So the first one is, are there situations in which parents who withhold immunizations from their children risk harming them sufficiently that their decision constitutes actionable medical neglect and should be reported to state child protective? Second, are there situations in which a parental decision to withhold immunization from a child puts other individuals at risk of harm sufficient to justify public health intervention? And third, how should pediatricians respond to a parent who refuses immunizations for their child? So, just kind of broad strokes here. The goal of immunizing a child is to improve the welfare of the child. That should be the primary focus. Parents, however, are free to make choices regarding medical care unless those choices place their child at substantial risk of serious harm. So see the nuance that's developing? That's like for lawyers to figure out. Is it a substantial risk of serious harm, or is it a minor risk of minor harm, right? So the balance between risks and benefits to a given individual favors immunization most strongly when the rates of immunization in the community are low and the disease prevalence is high. So what happens when it's the reverse? So, for example, the benefits of measles vaccine clearly outweighs the risks at a population level. An unimmunized child living in a well-immunized community derives significant indirect protection from herd immunity. However, the risk remains low, and in most cases, the parent who refuses immunization on behalf of his or her child living in a well-immunized community doesn't really place the child at substantial risk of serious harm. So I'll move on from there. Parents who choose not to immunize their own children increase the potential for harm to other people in 4 ways. First, should an unimmunized child contract a disease, that child poses a potential threat to other unimmunized children. Second, even in a fully immunized population, a small percentage of immunized individuals will either remain or become susceptible to that disease. These individuals have done everything that they could to protect themselves through immunization, but they remained at risk. Third, some children cannot be immunized because of an underlying medical condition. These individuals derive important benefit from herd immunity, and they may be harmed by contracting disease from those who remain unimmunized. And last, immunized individuals are harmed by the cost of medical care for those who choose not to immunize their children and whose children then contract the vaccine-preventable disease. So there's a lot to think about, right? With regard to immunization, the key question becomes whether the harms associated with unimmunized individuals are great enough to make restrictions permissible. In times of epidemics, when an effective vaccine can end the epidemic and protect those individuals who have not yet contracted the disease, then the answer is clearly yes. And then they have a little discussion about how to respond to those parents who refuse, and they certainly say that, I think this is very nice, the pediatrician should listen carefully and respectfully to the parents' concerns, recognizing that some parents may not use the same decision criteria as the physician, and may weigh evidence very differently than the physician does. They give an example. If a vaccine has encephalopathy as a possible side effect, for example, although the risk of encephalopathy related to the measles vaccine is 1 in 1 million, the risk of encephalopathy from measles illness is 1,000 times greater.
Can you say what that means?
Encephalopathy is basically it's an infection of the brain, which then leads to a pretty significant outcome, some type of brain damage. And so again, it's very clear when you read through this article, that this research article, that the AAP states that there are known risks to vaccines. You can't say that a vaccine is absolutely 100% risk-free, but that the illnesses carry much higher risks. So,
and that correlates with the US CDC's kind of concept that vaccines are safe and effective, but they are neither perfectly safe nor are they perfectly effective. And I think as an example here, we used to get oral polio vaccine, and OPV causes paralysis in 1 in every 2.4 million doses. And since there's no wild polio in the Western Hemisphere since 1991, in 2000, the US CDC changed its recommendations to go with what's called IPV, or inactive polio vaccine, which has no risk of paralysis, but is slightly less effective than OPV. So society as a society, we change our approach to certain diseases based on their prevalence.
that's right, because what we realized was that the only polio cases in the US were related to vaccine. That wasn't acceptable. Just going to read this little piece about what to do, those pediatricians who consider firing their patients. In general, pediatricians should avoid discharging patients from their practice solely because a parent refuses to immunize their child. However, when a substantial level of distrust develops, significant differences in the philosophy of care emerge, or poor quality of communication persists, the pediatrician may encourage the family to find another physician or practice. Although pediatricians have the option of terminating the physician-patient relationship, they cannot do so without giving sufficient advance notice to the patient or custodial parent or legal guardian to permit another health care professional to be secured. Such decisions should be unusual and generally made only after attempts have been made to work with the family. So that struck me as something that should not be occurring, according to the AAP, 25% of the time. So I'm going to just throw out some rhetorical questions for you guys to tell me what you think. So again, related to what I just said, many physicians have chosen the tack that not immunizing their patients is tantamount to doing something against medical advice, AMA, and they refuse to treat those patients and families. Do you think that's ethical? But before you answer that, is it unethical for a physician to treat a family that refuses to vaccinate? And I don't know, do you understand the nuance there? Because if the physician is supposed to do what is supposed to provide the least amount of harm, the most amount of safety, and to take care of that patient, should they continue to see that family if they're basically doing completely against what the physician thinks is right? So I just wanted to hear some back and forth about that, if you guys have any thoughts.
And potentially impacting society in general. As physicians, they have an obligation obligations. They're individual patients, but they also have obligations to society in general.
Anyone but me?
How about 1, 2, and then 3? So Liza first.
So I'm trying to analogize it to something else, like if you're not a pediatrician, you're a primary care physician, and you have an obese patient, and you've told them that they should exercise more and eat well. Do you not continue to treat them if they don't do those things, which happens all the time? I mean, I feel like it's not quite the same, but it's similar in that not continuing to have regular checkups with them and monitoring their blood pressure and whatnot, that is worse than allowing them to continue with their poor behavior and, you know.
The ethical nuances may be a little bit different there, but I think the legal question is the same between those two fact patterns, and the same with if you have a patient who you have a contract with who's on opioid therapy, and they're choosing to abuse their opioids, they break their contract, you can terminate the relationship with that patient. Again, I'm not giving any legal advice here, but you always have to be careful if the patient has an alternative, has information about arranging for alternative methods of care and treatment, and that's what the APA is suggesting here in this article, that you just don't walk away from the patient.
Yeah.
You have to make sure they have the supports.
I guess the thing I would respond to is that's a patient who is non-compliant, but is that patient potentially putting the local or state population at risk?
That's what the for.
Yeah.
Yeah.
So, yeah. I think you have to do
Well,
yeah.
halfway. I kind of come at this from the perspective of feeling, well, some of my best friends have chosen not to get vaccinated, and I feel very forgiving about that and feel like that's a fine decision to make. So I feel like in this issue, it kind of like, there are two things that are at tension, which is the sort of two different like American ideas. Like one is like, I should be able to do what I want, and that's the argument for being able to choose not to get vaccinated. And the other one's kind of like more is better, which is the argument for let's have everyone be vaccinated. And I guess I feel like I fall more in the favor of people being able to do what they want. And it seems like, especially if there's not a big issue, I feel like, I don't know how to say this that well, but it feels pretty obvious to me that the doctors should be under an obligation to treat somebody that's fallen to harm after choosing to not be vaccinated, because somewhere in my mind I take for granted they've made an informed decision and they just had bad luck.
I think that's great.
Within the realm of bioethics, which is really what this debate is all about, it's bioethics based. So there are principles in there, and when you describe the individual being able to do what they want, what's the term that we attach to that in bioethics?
I don't know.
Autonomy, right? And that which, the courts generally recognize this as the first principle of medical ethics, is autonomy. We have the right to do what we want with our bodies, with our minds and our bodies. And we saw that in Cruzan, the right to die based on certain facts there, without getting into the facts of that case. Roe v. Wade, another perfect example there. But the corollary to autonomy is what?
Living in society.
Beneficence. That's the corollary to autonomy there. And that's do no harm. That's where the Hippocratic Oath comes from. It's from the beneficent role of a healthcare provider. And do that which is good. So do no harm. It's an oath now. The physician takes that oath. I will do no harm, and I will do that which is good. So the conundrum, the ethical conundrum that pediatricians and family practice docs are placed in with this immunized versus not immunized is really, it's not only a conundrum for the parent, but it's also a conundrum for the provider as well.
And actually, to add to the comment that man had made, what I heard from you was that you were very forgiving of your friends who chose not to vaccinate. But remember, this is a toddler who doesn't have the ability to make the choice. So now you have a parent who's making the choice on behalf of the child. And that just adds to the complexity of that discussion.
And that's where parents' patronage comes in, because you've got the state ultimately who's ultimately responsible for that child, absent a parent or absent a guardian. That child goes to the state. So the state's power then is to say, for that child, who may become a ward of the state and a burden to the taxpayers, to put it crassly, we're going to assert that that child will be immunized to be as healthy as possible.
I know there were hands over here.
You guys are mindful of the time, right?
Time.
I was about, we have 10 minutes and so.
10 minutes,
this
just question and
is
answer.
great, so,
Okay.
yeah.
Thank you.
Did you still, okay.
Well, I think I think you answered my question. I was gonna question the Hippocratic Oath because you said do no harm, and then you said do the most good, which I didn't quite know that that was part of it. And so is that the most good? It seems like you've expanded it.
So certainly do no harm is the way it reads. The ethical dilemma that we all get put into is, for example, vaccinations we consider to be doing no harm, but we talked about how the US CDC even states that that no medication, in this case vaccinations, aren't perfect, and they all have the possibility of a side effect or harm. So I feel like I don't know if there's like a legal term for what I'm saying, but there's do no harm, and overlay is the real world, which is that you could allow the child to get measles and they could die from measles. You could give them a measles vaccine. They could be the 1 in a million who gets a side effect from measles. How do you choose do no harm of those two choices? What is the, you know what I mean? What is the do no harm? Because that's an absolute. So a lot of times, unfortunately, you have to defer to do the least amount of harm, do the most good.
Which is the other tenet of beneficence, is do no harm and do the most good. Those are both co-equal tenets of beneficence under the law.
Thank you.
Yeah, well, I was going to ask, are there sort of any incentives around having a higher, of your panel having a higher vaccination rate? And could that explain why certain physicians are opting to?
I was going to say flat out, absolutely no. But, in this age of quality metrics and performance, you know that the outcomes that physicians have are being tracked and monitored. And so I can use a personal example, which actually will move to one of the other questions I have, but if you have patients who you allow to defer a vaccine until they're ready, as opposed to never doing it, because again, there's the issue with the absolutes. If the patient says, I will absolutely immunize my child with all the vaccines that you have, but I won't follow the CDC schedule, versus a parent who says, I won't vaccinate at all. As a physician, which are you going to choose of those? And so the problem is if you choose to delay a schedule, but ultimately get that child fully vaccinated, your ACO, perhaps your state immunization program, will come and talk with you and send you.
Can you say what an ACO is? I'm not sure.
Accountable care organization, so it's sort of, in this particular area, it would probably be like Maine Health, for example, or Eastern Maine Health have groups of hospitals and providers where they're tracking metrics and taking a look at metrics over a large group. They want a certain percentage of their patients to be fully immunized. But what happens for providers is that you get your document every quarter, which looks at your immunization rates, and you have to confront it and deal with how important is it for me to know that my immunization rates are not 100% or not 90%, if that's the goal. So I will say at this point, it isn't one-to-one. It isn't like, okay, if I get an 85%, I throw up my hands and say that's what I'm firing all the, it's not like that. But it is one more thing added to the rubric of the primary care provider to think about. So I wouldn't call it an incentive, it's almost like a disincentive to allow patients to not be immunized.
That question raises a really good point, though, I think, in that as we move towards value-based purchasing in the healthcare arena, so we're demanding a certain amount of value for every dollar that we're going to invest in healthcare, It would, I know in those discussions, immunization rates by providers are absolutely part of those discussions. We haven't, there's been no attachment that I'm aware of actual dollars to that yet, but I think it is moving in that direction.
And I will say that the pushback that providers give to those groups that give them their percentages about immunization is, okay, you're telling me that my chickenpox vaccine rates are horrible, but I am allowing patients to make their own decision, right? They have autonomy to do that. So you're punishing me for allowing them autonomy. So why is the stick being thrown at the physician and not at the family?
It's one way to get at them, right?
I'm down to my ears, it's all
We
good.
literally have like
We have 5
5 minutes left.
So are there any questions before?
I just have a quick question, as far as pediatricians refusing to take care of patients that have chosen not to be immunized. I mean, that's like period, right? Like, you're not gonna treat that kid at all because it hasn't been immunized, right? That's how that works?
In the examples of those pediatricians who have done that,
Yeah,
yeah, they've given them
I mean,
like a
so if the
30 or
kid comes-
60-day notice, and they have to.
right. So if the kid comes back and the kid has like a broken leg or something like that, that pediatrician is not going to treat the kid.
Oh, no. So the way it works is, for example, if you were going to terminate your physician-patient relationship, I think by state law it says 30 days, that you have to give them notice, and you have to say that from 30 days from the time that you receive your notice, I will no longer be able to treat you. So you now have 30 days, the clock is ticking, you now have 30 days to find alternative care. If you need to be seen emergently within those 30 days, we will still continue to provide care for you.
Okay, but so let's say those 30 days are up though, right? It's over, I live in rural Maine and I have 3 kids and you're